Hello, everyone. If you could all just grab a seat, I think we're going to try and get started and not keep the day going any later than it needs to. I hope everyone's been having a great summit. All right, so I'm pleased to be the moderator for this session. My name is Michael Quagg, and I'm the director of the Community Alliance Initiative at the Community-Based Research Center, which is a new initiative that we're doing in partnership with Health Initiative for Men, AIDS Committee of Toronto, Max Ottawa, and Réseau. We had hoped that we would be able to do more of a description of the project that was a little bit more concrete. I imagine that some of you have heard about this big initiative. We are hoping to put out some communications around this exciting new initiative soon. But for now, given that we're still kind of in conversations with PHAC around finalizing the project, you're just gonna have to sit tight for a little bit longer. Before I introduce the speakers for this panel, I just want to acknowledge that the MP for Vancouver Centre has joined us today, and that is Dr. Hedy Fry. Dr. Fry has Dr. Fry has been a longtime supporter of LGBT rights and health, and we're always happy to have our local politicians and other partners come to join us for these important meetings. So welcome, Dr. Fry. So our first speaker today is AlexSmith. You heard from him yesterday, and we're lucky to hear from him a bit more about the Davie Buyers Club. So Alex has been working with individuals and communities affected by HIV since 2007. He created the Davie Buyers Club in 2016 as a pathway for PrEP access due to the unmet need he observed while working as a registered nurse at the Health Initiative for Men Clinic in East Vancouver. He currently resides in Calgary.
Thank you, Michael, and thank you to the CBRC for inviting me to speak at this conference. It's a great pleasure. That was pretty much the topic of my discussion, so I can pretty much sit down now, I think. But, now I'm going to talk about the Davie Buyers Club. First of all, I just wanted to make it clear with disclosures that I'm not affiliated with any of the pharmacies or medications described in this presentation or on the website. I've got no financial interest to disclose. And also, the views expressed are my own, and I'm not speaking on behalf of any past or present employers. So yeah, what I wanted to cover today just included some background of how the Davie Buyers Club came to be. What is it? Some of the evidence for its safety and efficacy and as a pathway. And as well, some of the successes and some of the shortfalls of this process. I wanted to talk about the impact on individuals, on public health, and touch a little bit on impact of on the healthcare system. And I guess we have some time for questions at the very end. So as this is a bit redundant because Michael introduced me, but yeah, I'm a registered nurse. I've been working in the field of HIV for a long time, whether it be in clinical research, working with inpatients, outpatients, in testing, treatment, and prevention. So yeah, I live in Calgary, and I'm not a PrEP user or an MSM person. So as the recent article in Vice said, you know, why did a straight dude from Calgary create the Davie Buyers Club? Which is a fair question. So as Michael introduced, as a registered nurse, I worked at the Health Initiative for Men on Commercial Drive in Vancouver, where it was essentially every day that I was asked by my clients for PrEP, usually multiple times a day. And you know, with the lack of a public program and with very few clients with a Cadillac insurance policy, there was very little that I could do for these clients. That was often where the conversation began and ended. And that was very unfortunate. But what was much more unfortunate was subsequently diagnosing some of these young men with HIV after having this conversation where they had identified themselves as a candidate for PrEP. That's something that they desperately wanted, and because they could not access it, they subsequently seroconverted. And this was highly distressing to me. So going back to nursing school here, the topic of moral distress, I think, is well defined as the stress that occurs when one knows the right thing to do, but there are institutional barriers that prevent you from doing it. And this is very much what I felt as a nurse on Commercial Drive. So faced with this distress, I had a couple of options. One option was to involve myself in advocacy and policy and go through the proper channels to advocate for PrEP access, as part of the British Columbia formulary. Frankly, that is not an area of my expertise for me. I didn't think that my contribution would be particularly valuable. I know that there are very talented people already committed to that work, so I didn't think that that was the best option. So as a registered nurse, I'm used to evaluating evidence, coming up with creative solutions to meet the needs of patients, and that's the road I chose to go down, albeit a bit of a rogue road. The other option, or the other thing I had to consider, was whether to put my name on this or not. And that's a question that I get asked very frequently. Why were you anonymous and for so long? So when I started this, which was in June of 2016, I hadn't ever really seen anything quite like this, and I didn't know how the people who regulated my profession or employed me would think about this. So I on one hand, wanted to meet the needs of the patients that I saw, but I also wanted to keep my job, which pays my bills and provides me with a sense of belonging and meaning in my life. And I wanted to continue to be able to care for my patients. So that is the reason that I decided to do this anonymously at first. So what is the Davie Buyers Club? Most of us here, I think, are familiar with it. It's got a lot of buzz, in the media, on social media especially. Essentially, it's a website that guides people how to first connect with primary care and be assessed and prescribed PrEP, but then to fill that prescription with an overseas pharmacy for a much, much reduced cost, about $45 a month compared to about $1,000 a month when I first started this for a brand name Truvada in Canada. And it guides people to, well, I'll get into that shortly. But what it is not is an actual buyer's club. That term actually has meaning. I do not buy, sell, or otherwise distribute any medication. It's an educational guide, and as a person online, I can answer questions and offer guidance and support for people. It's pretty much just me, although I do get some help along the way. I've had some friends who were the initial guinea pigs to trial this and head across the border with their prescriptions. A picture is worth 1,000 words. This is a graphic that I had created. Shout out to Nick Graves Design in Victoria, who made this almost for free. But it really, I think, succinctly describes the process that I introduced, where people get a prescription, they get a mailbox in the U.S., and that's because medications aren't allowed to be shipped directly to Canada, regardless of their legal or their approved status, regardless of prescription. Canadians just can't import medicine by mail, but in the U.S. you can, and that's why people have to set up a mailbox there, and they travel across the border every 3 months to pick up their meds. Touching a little bit on safety and efficacy, Will touched on this in his talk yesterday, just that much of this comes from the UK. So from the sources of online PrEP that I describe in my website, they're the same sources that people in the UK and Australia have used, and really, I didn't invent this process. I merely adapted from systems that people were already using in the UK and Australia. But from the UK, 56 Dean Street and other clinics have presented data now on over 200 patients who are taking PrEP online, and this therapeutic drug monitoring has shown that the people who access PrEP in this way actually have PrEP in their system, and it's in safe and effective amounts. We're doing a smaller scale trial here in Vancouver, and when I say me, I mean mostly Dr. Hull, and I'm along for the ride. And we're currently recruiting participants to do this same type of therapeutic drug monitoring here in Vancouver. So if anyone's interested in participating, check out my website. So how many people use the Davie Buyers Club to access PrEP? This piece on engagement here talks about how many people have visited the website. On a typical day, about 50 people visit it, over 17,000 visits as of when my slides were due. This also highlights a big part of my continued involvement. So yeah, there was a lot of work in creating, in researching the process, its safety, its efficacy, describing the process in a way that is accessible to people. So that was a lot of upfront work, but the work since then has been in responding to the inquiries that I get pretty much every day from across the country. So far, yeah, I've responded to over 300 emails and Facebook messages. The most common one is, how do I get PrEP? Which it confuses me a little bit because that is the sole purpose of the website. But yeah, I do the best with that I can. Lots of questions about clarifications and troubleshooting, order inquiries and delays, and people asking, is this normal? Is this not normal? What should I expect? Questions about connecting to care providers. How can I get a prescription? And often I don't know the answer. I don't know who is the best prescriber in New Brunswick. But through the connections that I've made online with the Davie Buyers Club and other aid service organizations across the country, I'm able to connect people to care, and that's been pretty cool. Other questions I get are requesting medical advice, and I also obviously refer those questions out. When I do my Davie Buyers Club work, I do it in the role of an educator and an advocate, and not as a healthcare provider. So I don't give advice. So how many people, after accessing the website, actually get PrEP into their hands? The short answer is we don't really know, but these data here suggest a best estimate. So I've got some order information from a 3-month period from 2 out of the 3 online pharmacies that my website describes. And I used a 3-month period because people order 3 months of medication at a time, and I figured that a 3-month period for orders for Canadians was a decent proxy for how many people are accessing PrEP. So yeah, with 150 from one pharmacy, 26 orders just to that one parcel service in Point Roberts. I know that many people elsewhere in Vancouver and across the country access that pharmacy. So, and then there's All Day Chemist. I have no numbers or communication with them, so who knows. But considering all that, I figured it was a reasonable estimate to say that 200 Canadians are accessing PrEP this way who might not otherwise have access to PrEP. I talked about some of the barriers and challenges in the talk yesterday. So just to briefly repeat those, funding is still an issue. I've had some people say, who can afford $1.50 a day for PrEP? And although many people can, certainly some people can't, and I have heard from those people, especially when you have to pay for 3 months at a time upfront. That is still a barrier, and certainly proximity to the border. It's great for guys in Vancouver. You can take the bus to the border, but for the people that I hear from in Calgary, which is 3 hours from the border, Edmonton, which is 6, this very quickly drops off for its feasibility as one gets away from the U.S. border. Another issue is, I think I touched on yesterday, is literacy and self-efficacy. So sometimes I've been able to connect clients who've been having difficulty following the rather complicated instructions for a complicated process to services like the Health Promotion Case Management Team in Vancouver, who have services in multiple languages. But I imagine that some of those clients have fallen through the cracks. I've heard from clients who have a criminal record that prohibits their entry to the United States. And ultimately, as this says here, importation of medicine on one's person is at the discretion of the border agent. So fortunately, there have been just 2 examples that I've heard of, and people seem to let me know about every problem, so I think this hopefully is representative. Through the hundreds and hundreds of cross-border trips with medication, that there have just been these 2 examples of refusal. I hope that they are the only 2. I kind of think that maybe in the prairies they don't have anything better to do, but anyway. So speaking of partnerships across the country, I've made some really great partnerships. Some of them formalized, some of them informalized, and this was a more formalized partnership that I'm proud to be a part of with the Gay Men's Sexual Health Alliance of Ontario. And we collaborated to adapt the Davie Buyers Club Guide specifically to the needs of and context of Ontarians. So that was really cool that we could collaborate. We also turned it into, or created an online evaluation with Dr. Tan. I imagine that participation in that will decrease precipitously with the coverage of PrEP in Ontario, but as I said to Dr. Tan, I've never been so happy to have a study tank. So what kind of impact has the Davie Buyers Club had on public health? Again, who knows? But and the statisticians of the room are going to be cringing at this slide. But like I said, this is not my day job. This is a very crude estimate. With an estimation of 200 people on PrEP who wouldn't otherwise be, and a number needed to treat, so that's the number of people who need to be taking PrEP in the real world every year in order to avert one HIV infection, as shown by the clinical trials. So that number needed to treat was 52, I believe, in the IPREC study, and 13 in the PROUD study. So using that as the denominator, I think it's reasonable to vaguely estimate that the Davie Buyers Club will have averted somewhere between 4 and 15 real-world HIV infections this year, which is small but something to celebrate, I think. So impact on individuals. I mean, I've heard from people across the country who have been very thankful and very appreciative for this process. I mean, at the end of the day, it is them that is navigating this process, jumping through the hoops, crossing the borders. So, I mean, I think that the celebration, the pat on the back is to them, should be to them, but it's emails like this that really, really moved me. This was a client who I saw at Him on the Drive, as you can see. This was one of the clients who I had in mind, essentially, when I made the Davie Buyers Club. So to hear that he had, heard about the website and accessed it and wrote me about the effect that it had on his life and his health was immensely gratifying. So its impact on individuals has not just been other people, it's been very meaningful to me as well. I wanted to comment, again, my slides are a little bit incomplete, but I thought there was an interesting, hopefully a legacy of the Davie Buyers Club that Dr. Hull mentioned in the talk yesterday with regards to the effect of the Davie Buyers Club on creating demand in the mainstream healthcare system, creating pathways to PrEP. So I understand that Davie Buyers Club clients or people wishing to use that to access PrEP was at least a part of the impetus to create the PrEP clinic at Him on Davie. So I hope that the buzz, the access, and the sort of carving into the mainstream healthcare system will also be a legacy of the Davie Buyers Club. I would love to shut down this website tomorrow. I don't think that will be the case, but I look forward to that day. Thank you very much.